Mr. Chairman, and thank you for holding this hearing. And thanks to all of our very excellent witnesses who are with us today. The disparity that the witnesses have talked about is certainly true in my district. In Sonoma County, in my district, the Hispanic community accounts for almost 60% of the COVID cases, while they make up only 27% of our population. In that same county, 95% of young people with COVID are Hispanic. That's 54 out of 57 cases. Unfortunately, these heartbreaking numbers are nothing new. As we've discussed before in this committee, racial and ethnic disparities have persisted for decades across our healthcare system. These disparities have been laid bare by COVID-19. It's critically important that Congress tackle this issue with the urgency that it requires. I'd like to start by talking about something that Mr. Smith just raised and a couple of the panelists have mentioned. That's telehealth and telemedicine. I'm the founder and the co-chair of the Telehealth Caucus, and I've been a big proponent of telehealth for my 20 years in Congress and before that as a state senator in California. It was my legislation authorizing the expansion of telehealth in Medicare. It was in our first COVID bill that we passed. And while I'm pleased that more and more people are taking advantage of telehealth, I share some of the concerns that Dr. Fernandez brought up. And Dr. Fernandez, if I could ask, can you talk a little bit more about those barriers to telehealth that are faced by communities of color, including the Hispanic community in California? And more important, what are some of the specific things we need to do to make sure telehealth expansion is equitable and to make sure that everyone is able to benefit from it?
Thank you. I think language is a huge barrier. And for a large portion of the Hispanic community, that is a huge barrier. Last week, I took care of a Cantonese-speaking patient via the telephone. Even though I was assisted by a Cantonese interpreter, it is extraordinarily difficult to adjust insulin when you're using an interpreter. You can't see the patient. It is extraordinarily difficult. Unfortunately, the solutions to those are longer term. One is to make sure that everyone has access to televideo, which is better than telephone. Second, to make sure that televideo is as simple to use as possible. And third, the longer term solution is to diversify the healthcare workforce so that we have more language competence among physicians. I ended up wishing I had spoken Cantonese, as there is good science to show that that would have really helped my patient.
Thank you. Thank you very much. Dr. Kendi, can you talk a little bit about the differences we've seen in states that expanded Medicaid versus states that chose not to? Have communities of color fared better in the states that expanded Medicaid under the Affordable Care Act?
So I'm not aware of a study that specifically has been able to answer this question. But one thing we do know is that, for instance, in near you, a recent study was done that found that Black patients were more likely to show with advanced form of COVID-19. They were more likely to be hospitalized, actually at 3 times the rate of white and Hispanic patients. And we're seeing that around the country, in which Black people are presenting, or first of all, being hospitalized more than other groups. And so when we actually look at the reason why, one of the reasons people are suggesting is a lack of access to health insurance. And so if you look at the states that have not adopted, you can look at in Kansas, there's a 25 Black people are 6% of the population, but 31% of those who died according to the COVID racial data tracker. In Missouri, Black people are 12% of the population, but 38% of the people who died from COVID. And you looked at the same massive disparities in South Carolina, in Georgia, in Alabama, in Mississippi, on down the line. And so there's something there that I think we need to look at, because clearly one of the factors that's more predictive of someone having pre-existing conditions is very simply access to medical insurance.
Thank you very much. I yield back.